I'm Rachel Zuckerbrot. I'm an assistant professor of clinical psychiatry at Columbia University Medical Center, New York State Psychiatric Institute. Well, we know that there are only 900 child and adolescent psychiatrists in New York State, and there are many counties in New York State that don't even have any child psychiatrists. So we know that a lot of these kids don't have any chance of seeing a child and adolescent psychiatrist, and many of them are going untreated. We estimate that it's about 1 million children in New York State that have mental health problems. So New York State Office of Mental Health has funded since 2010 a wonderful program called CAPPC, Child and Adolescent Psychiatry for Primary Care. We have a toll-free number that's open 9 to 5, Monday through Friday, and it's staffed by child therapists and child psychiatrists. Any primary care doc with any question related to a mental health problem in any of the kids that they're treating can call this line at any time and get help from the child psychiatrist directly on the phone. The PCPs can get help with all sorts of issues. They call from anything from ADHD to depression to anxiety. They call to ask if a question is psychotic when they're not sure if what a kid is saying is an auditory or visual hallucination. Some of the calls we get are really about advanced questions about parenting and parent training. We help them figure out the educational system and how to get educational supports for kids. We've had them call about really young kids who they're worried about some trauma that happened in the household and what they should be doing to prevent mental illness, and we've had them call about severe mental illness that might be showing up in their older teen population. So the New York State Office of Mental Health was hearing a lot of complaints from the primary care providers in New York State, both family physicians and pediatricians, that the mental health system was full and overloaded, and they would have children that needed help and they couldn't get them into the mental health system. And they were complaining that they hadn't been trained during residency about what to do, and yet here they were with these kids, they couldn't get them into mental health and they didn't know what to do, and they were now responsible for treating these kids for mental health. Yeah, so New York State decided to provide CAPPC to answer this problem and to provide not only these consultations but also trainings. And we provide annually, at least both to upstate and downstate pediatricians. We provide a 3-day training that comes with 6 months of case-based conference calls. We call it a mini fellowship, where they practice and they do role plays and they bring cases to discussion, and they learn about both the assessment of mental health problems in their kids and about the treatment and management and when to refer and how to establish rapport with kids and everything that they really might not have gotten during residency, but that they need, because when you create a medical home, it also includes the mental health piece.